My name is Christina Wallace, and I'm going to be doing ostomy care today. First, before I walk into the patient's room, I'm going to verify the order. Then I'm going to walk into the patient's room, introduce myself, and I'm going to perform hand hygiene and put on clean gloves. The first thing I'm going to do is I'm going to look at the patient, look at the bag. If there's anything in the bag, I'm going to empty the bag, and I'm going to record it on my intake and output on my computer. I'm going to make sure I have towels in the room with me as well. I'm going to put on clean gloves. After the bag is empty, I'm going to remove the bag, make sure that I'm looking at the stoma site, seeing if it's any infection, any drainage. I'm going to ask the patient, are they having any problems with it? Then what I'm going to do is, they might already have a pattern from their stoma site already on the board. I'm going to take that pattern and I'm just going to cut to how their stoma is. And while I'm doing this, I'm going to make sure I have a clean towel over the patient. This is the patient. This is the stoma site. What I'm going to do is I'm going to put this over to make sure that it fits properly before I detach my tape with the backing of the ostomy bag. I'm going to pull this off. I'm going to apply it to the skin, but I'm also going to make sure that the skin is cleaned around the area and patted dry before I do this. I'm going to apply it and hold pressure, making sure that I seal down all the edges. Okay, and then what I'm going to do is the bottom part. I'm going to make sure that I close this, because if not, my contents are going to leak from out of it. Okay. I'm going to tuck it in. Okay. So the pouch is on. The spout is closed at the bottom. Then what I'm going to do is I'm going to gather all my dirty supplies, take off my gloves, throw everything away, and then I'm going to document what I did in the patient's response.